Hello everyone, and welcome to this webinar on impact of COVID and social protection, what measures work. We are all welcome. This is the fourth webinar in a series of webinars being organized by FAO's Regional Office for Europe and Central Asia. Previous webinars have focusing on the topics of lifting the lockdown, extension services, on smallholder farmers, and family farms, and now on social protection. As we continue to understand and adapt to the effects and challenges of COVID, the purpose of these webinars is to facilitate information exchange, experience sharing, and provide a platform for discussion and exchanging views. We are here to listen and to learn. My name is Ana Ocampo. I'm a social protection officer based in FAO's headquarters in Rome. I'm very pleased to moderate the webinar today. Social protection has emerged as one of the major responses to the secondary impact of COVID, and today's webinar will focus on identifying what measures worked better. Before we start, I just wanted to give you a bit of technical information on the webinar platform. You have an interpretation function. It's at the bottom of your screen. There is a little globe that says interpretation. If you click on it, you have two channels, one English, one Russian. So you choose the one you prefer. We ask all participants to switch off their mic. And the last thing is that we will be taking questions from the audience throughout the webinar, and we would kindly ask you to use the Q&A specific function. There is a Q&A chat. It would be great if you can use that instead of the normal chat, so we can monitor your questions better. And now we can start. I would like to introduce and hand over to Mr. Nabil Ganji. He is the Deputy Regional Representative for Europe and Central Asia, and he will be giving the opening remarks to this webinar. Nabil, the floor is yours.
Thank you, Anna. Distinguished panelists, esteemed participants, dear colleagues and friends, good morning and good afternoon. It's an honor to welcome you to the FAO fourth such webinar on COVID-19 in Europe and the Central Asia region. As you know, our Zoom-based webinar is also available on the FAO YouTube live channel. The COVID-19 pandemic has adversely affected Europe and Central Asia, and FAO is playing a role in understanding and assessing the extent of its impact on people's lives and livelihoods, hence ensuring the appropriate response. In this unprecedented situation, colleagues, it is crucial to learn from each other regarding the adequate measures to be applied in the different countries. With these webinar series, we are focusing on facilitating a multi-stakeholder dialogue in the region in order to support information sharing among the experts and the countries. Evidence collected in the region suggests that the COVID-19 pandemic is having widespread impact on health, food security and nutrition, household income, employment, and resilience. Indeed, many households have been and continue to be pushed into poverty due to job and income losses. This situation is exacerbated within the traditionally disadvantaged and vulnerable groups. Rural households, informal workers, migrants, smallholders and agriculture producers and food value chain workers. As these categories usually have limited access to resources anyway to allow them to cope with any negative impact affecting their incomes. Women are under even increased pressures due to school and kindergarten closures. On top, they are usually the ones who are hardly covered and have access to social protection measures. We all know that leaving no one behind is a central premise of the 2030 Agenda and all the Sustainable Development Goals, which should be met for all people in all countries and for all segments of society. Uniting efforts and working closely with our partners in ensuring social protection for all is essential for any success to be achieved. FAO is a member of the Issue-Based Coalition on Social Protection in Europe and Central Asia, which provides support to all UN country teams in the region to accelerate progress towards social protection-related sustainable development goals, including SDG 1, no poverty, SDG 3, good health, and SDG 8, decent work and economic growth. Since the COVID-19 evolved, many countries in the region have scaled up their social protection programs. In fact, all countries in Europe and Central Asia have introduced measures that cover one facet or the other of social protection. The variety and scale of the adopted measures help identify what worked and what did not meet the needs of the most vulnerable groups in the region. The development world has come a long way in its views on social protection and support measures, as ample evidence in all regions of the world has demonstrated social protection has proven to increase the household food security, eliminate barriers to access essential services, and strengthen rural livelihoods and production capacity, as well as improve household resilience to withstand and cope with shocks and crises. Through today's webinar, FAO is providing a platform for sharing information and analysis on social protection measures adopted by governments since the start of the pandemic. In addition to learning about the challenges and opportunities in implementing social protection measures, the discussion aims to go beyond inventories and policy declarations into how-to matters and to focus on outreach and rural populations. Thank you for your attention and participation, and I look forward to our fruitful discussion. Thank you.
Thank you very much, Nabil, for these welcoming remarks. They set well the scene, I think, and introduce well the following presentation. Our next panelist is Benjamin Davis. Benjamin is the leader of the strategic program for the reduction of rural poverty in FAO. And he will give us an overview of the social protection response to COVID and the opportunities that this represents. Benjamin, over to you.
Great. Thank you very much, Anna, and good morning, good afternoon to everyone. Thank you very much for the opportunity to be here with you all today. I'm going to take just a bit of a global perspective in this presentation, and following very well on what Nabil just described. And I think COVID obviously is the greatest shock globally in our generation, certainly. And it's really exposed glaring disparity in access to health services, insurance, outcomes, sanitation, education, access to information, the internet, which is shown to be so fundamental now, particularly in this context. Inequalities in access to housing, the ability to shelter in place safely, and really the formality of employment, which is so important just because it's linked to the ability to manage risk, right? And 2/3 of the world's of those whose livelihoods are linked to food systems are, in fact, that's over 3 billion people. Their livelihoods are informal one way or another, and really the inequality in any way to manage risk, and particularly the formality of employment, has really been emphasized, so much more obvious by the COVID crisis. No? I mean, who's paid the price for this inequality? And again, we heard some of this from Nabil, but it's really worth reiterating. I think first and foremost, women have faced the double and triple burden of care in terms of taking care of children out of school, in terms of the sick. They're the first to go in economic crisis and the last to be rehired. They have a higher representation in informal employment, and they're facing reduction in non-COVID related health services, particularly reproductive health. Indigenous peoples, ethnic minorities, historically marginalized, facing insecure land tenure, and have been subject to increasing violence in different parts of the world. Clearly, migrants and informal workers, again, as Nabil emphasized, the poor in general in both rural and urban areas. And really, the inequality has magnified the impact of the crisis. The crisis itself will lead to greater inequality, which will magnify the impact on poverty in the long run. In the short term, it's having an immediate effect in terms of food security, and this is happening everywhere in terms of people reducing their consumption, reducing the diversity of what they eat. But it's also the threat of other negative risk coping strategies, including selling of assets, child labor, etc. And all of these have potential long-term consequences in terms of welfare and sometimes generational consequences as well. So why has social protection been the first response? First, it's clearly immediate support into the hands of the people. It helps protect incomes. It helps ensure food security and basic needs. It helps avoid some of these negative risk coping strategies. It helps address some of the demand side constraints, particularly in access to health services. And it also helps facilitate compliance with confinement measures. And so it's an immediate first step that countries around the world have been seeing. And we see that it's been the #1 response in countries around the world. According to the running analysis being carried out by a team led by Ugo Gentilini at the World Bank, over 195 countries have planned or introduced over 1,000 social protection measures in response to COVID. About 60% of these are social assistance, either cash or in kind. They tend to be short-term, around 3 months in duration, but very generous in terms of the amounts. On average, they're about 30% of monthly GDP per capita. And they're reaching a lot of people. And so they're reaching together almost a fifth or over a fifth, almost a quarter of the world's population. Unfortunately, there's wide regional disparity. And so it's only about 5% in sub-Saharan Africa compared to almost 40% in South Asia. And this is additional to programs which are already existing. About 26% of this response has been in social insurance in terms of unemployment benefits, et cetera, and about 14% in terms of labor market, wage subsidies, and what have you, which is more prevalent in REU, for example. So this has been a massive response, but we need to address gaps. Now, the current interventions are primarily temporary with limited plans for the long term. They're generally not adapted to specific vulnerabilities faced by vulnerable groups, and particularly women and girls, the burden of care, indigenous peoples, informal sector, around agriculture and food systems, migrants and seasonal workers, et cetera. So that's still a big gap. Coverage, particularly lower income countries, is still very low, even though countries are still ramping up. And many fragile and conflict countries haven't had any response. And vulnerable populations within these countries are often missed. Lower income countries tend to have less developed social protection systems with limited social insurance coverage and patchy social assistance programs with low institutional capacity and financial constraints. And so there's challenges in identifying, the target populations, reaching them and delivering benefits. And particularly in rural areas, remoteness, low density of population, high mobility, and this pervasive informality continues to hinder access to social protection. So there's still a big problem in terms of getting these programs into people's hands. Finally, just to wrap this up, social protection will play a fundamental role not only in this immediate response, but as we look forward to recovery and making it an inclusive process of recovery. One very important point is that universal approaches does not equal inclusive approaches necessarily, because there's many demand side constraints to accessing these programs, particularly among poor and rural communities. And the quality is always worse in poor and rural communities, which means you need to prioritize attention and focus the provision of public services in poorer and underserved areas. Also, not all recovery programs are equitable. In fact, they're usually not equitable. And so, which means you need to explicitly prioritize actions towards the sectors of the economy which are most relevant for the poor, small and medium producers, and businesses, particularly in rural areas. There also needs to be a focus on recovering formal and informal and temporary employment, and also improving working conditions along the way. And particularly important, as we've seen, is the issue around facilitating safe and orderly migration. And social protection plays a key role, just to finalize, in fostering this process of economic inclusion. It helps people move from this focus on survival to, again, planning for the future, helping households manage risk, serves as an insurance, facilitates access to credit, relaxes liquidity constraints, and helps smooth consumption. And when we combine and coordinate with measures to support small-scale producers and traders throughout the agri-food system, it can help foster this economic inclusion. And by addressing many of these demand-side constraints to accessing public services and public programs, it's a key element in making universal policies more inclusive. So thank you very much, and I look very much to hearing the discussion from the specific experiences which are taking place in the region. Thanks.
Thank you so much, Benjamin, for giving us these insights on the magnitude of the social protection response, but also going a bit deeper and behind the big numbers, and highlighting the disparities and the challenges that the social protection systems face, and all the bigger objectives, bigger goals that we should seek to reach: equity, economic inclusion, and so many in between. I would like now to turn to Natalia. Natalia Winter-Rossi is the Deputy Director of the Program Division and Social Policy Chief at UNICEF. She is also the former team leader of the social protection team in FAO and part of the SP3 management team. Natalia will present us a bit more the challenges that the social protection response to COVID has faced and what opportunities lay ahead. Natalia, over to you.
Thanks very much, Anna, and thank you so much to Reo and to FAO for the invitation. It's really great to be back and to be able to share the panel with my former colleagues and distinguished guests. And thank you, Anna, also for the promotion in my title, because no, I'm not the Deputy Director yet. Let me share my screen. I hope that I managed to do it properly. And just, I think, very much in line to what Ben described at the beginning, what I wanted to do was to maybe give a little bit of a flavor of how we're seeing the response from the UNICEF perspective, and also zoom in a little bit of what we've seen the region has been doing, the leadership that this region is taking, also in terms of social protection response, but also zooming in some of the challenges that we continue to see as we move forward. Let me maybe start by stressing that even though children has not been the face of the pandemic, the risk of being among the most affected is definitely greater, particularly in terms of poverty and socioeconomic impacts. A recent estimate study that we did together with Save the Children, based on World Bank and IMF data, was very clear in showing that on top of the 386 million children that are already living in extreme poverty, an additional 106 million can fall into poverty due to the crisis at the end of the year. And zooming into regional disparities, unfortunately, the Eastern Europe and Central Asia region could be hit the hardest, with an additional 44% of increase of children living in extreme poverty. I think that as Ben was mentioning, the current context is very clearly highlighting some of the critical inequalities and gaps that exist across different sectors. No, and let me add a couple of additional elements from a life cycle perspective. In terms of education, of course, exacerbating an existing learning crisis. And we know that even though it's not only preventing children from going to school, but also some of the measures that were put in place to address those closures are not an option from everyone, particularly, of course, for children living in remote areas, in rural areas, as well as for children with disabilities and in fragile contexts. The issues of gender, very, very well described by Ben, and I would add an additional component around how containment policies also further exacerbate some of the gender roles, and also are putting many women and children at the risk of additional child abuse, exploitation, and gender-based violence. In terms of health, even though children has not been impacted directly by the pandemic, there is, of course, other specific impacts. Many of them are at risk of getting access to some of the life-saving vaccines or preventive measures, given of a lot of the disruptions in terms of immunization services or other access to health service. We continue to see a limited ability to cover out some of the out-of-pocket health costs that are required in terms of prevention and treatment of COVID. So it's, let's say, adding an additional layer to the already existing daunting gaps. And of course, when we look at those children and families living in displacement contexts, refugees, migrants, and others, we have an additional challenges to face. Also, as was mentioned by all three presenters, we see that social protection is definitely at the forefront of the COVID response. But we need to be very clear in trying to be critical about how can we help this initial impetus and commitment from governments around social protection to actually have the impacts that we want. No? And I think we continue to see that there is still coverage gaps. In our case, looking from the life cycle perspective, only 1/3 of children worldwide are currently covered by social protection, either looking at child or family benefits. When we look at issues of adequacy, children with disabilities, children in fragile contexts, others continue to be excluded from accessing adequate protection. And of course, some specific elements of the social protection system beyond looking at social assistance or cash transfers are also lacking or limited. And as Ben said, here we have a very clear element around the care economy, family-friendly policies, the informal sector, which the crisis have really highlighted that we have a gap in terms of coverage for particularly the informal sector. We did a overview a couple of months ago on going deeper into the regional response on COVID-19, focusing on social protection, just to understand a little bit how the region was dealing with the response. I think one very powerful message is that a lot of the response globally, but also looking at with the regional lens, was based on national existing systems. Of course, some of these are only temporary with a short-term duration, but it's taking advantage of the structure of a system that already exists to be able to channel additional support to families that are already participating in these programs. Pensions and family benefits make up around 1/3 of the overall response in the region. Employment-related payments, also another 1/3, and some wide anti-party social assistance benefits around 1/6. Unfortunately, coverage remains an issue. And even though, again, governments have been very generous and committed, the gaps in terms of coverage and adequate coverage continues to be a problem. And these have been further highlighted in the response. Some of the economic stimulus packages that we've been seeing in some countries in the region have been put in place, have been focused from a national perspective. But not always with an explicit approach to really benefit or cover the poorest and most excluded populations. And of course, compensating with just one short-term cash transfer program will not really make a difference in terms of recovery and rebuilding their livelihoods and well-being. And even though it's important to identify that some of these packages have also gone to businesses and very important to, of course, re-engine the economy, there hasn't been a very specific focus on the smaller scale businesses, the smaller scale economic processes that are also falling behind and require that particular support. Sorry, why I cannot move this? Okay. I think that for us that have been looking at the region closely, we know that in comparison and relative to other regions, ECA has a very well-established set of systems across the region. These are well-established, long-standing systems that have been in place for many years. However, the challenges of the current systems have been, again, highlighted in the response in terms of fragmentation and limited coverage. So countries that have different parts of the system, different sectors contributing to social protection, but not necessarily coming together to provide a holistic and comprehensive response. There is a strong formal social security system covering many many households across countries, but given the precarious and increase in informal employment, there's still a lot of limited support, particularly for those working in the informal sector. What we call the missed middle, those that are not eligible for social assistance because they're not extremely poor, or are not in the formal market, therefore are not eligible to contribute to formal social security system. So we have a big chunk of the population that currently is not getting access to social protection programs. And even though this is a region where many countries have funded with their own domestic resources social protection, there's a very strong commitment around funding and around long-term programs. Some of them have been very narrowly targeted, particularly when we're looking at social assistance, having a lot of the population, particular children and women, excluded from accessing some of these programs. We also know that as these are well-established and long-standing systems, they're also they need to go through a very important process of reform in terms of removing some of the administrative barriers to entry, strengthening a bit more the coverage of the care economy and family-friendly policies, and also making the systems more flexible to be able to respond and become what we call shock responsive or risk informed, which is not still a part or high in the social protection agenda across the region. Despite some of the challenges and the inequalities that have been highlighted, I think it's important to also take this opportunity as a way of addressing some of the gaps, taking advantage, let's say, of the momentum that there's commitment around social protection. The social protection is visible across regions, and particularly in this region, being seen as one key strategy for the response, and work together across the UN system to really build back better and have a strong message around what we can do. No? Reinforce the commitment to poverty reduction, to SDG 1, really prioritize and the investments to build systems, not only to have temporary cash transfer programs, but to take advantage of really invest in making systems much more flexible, shock responsive, longer term, really trying to address, as I mentioned, some of the coverage and adequacy gaps that exist across systems. I think it's important that there is a commitment to financing all of the components of the system, not just the social assistance or cash transfers, which are critical, but also wider interventions that, particularly in this region, can represent a game changer in terms of protection, such as unemployment benefits or health insurance. There is a very, I think, a strong momentum to be able to address some of the coverage gaps, and child benefits, of course, is one of them, as one of the, let's say, the starting income support for families, and then starting building from that to be able to build on a better comprehensive system. I think, as Ben suggested, we've seen a lot of commitment around social protection as part of the immediate response, but it's important that we jointly push for it to be also a core pillar of the recovery phase or the long-term investment. Social protection is not a short-term intervention, but should be seen as a pillar to enhance resilience in the long run, and also make sure that families are able to respond better and to build that better their livelihoods as well as their particular well-being. I think this is an opportunity to really discuss what countries have been doing, the commitment of different countries, but also how we can join forces between different UN agencies, partners, and civil society to be able to address some of these challenges, some of these gaps, and provide one joint support to take advantage of the opportunity that the current context has provided us. Thank you.
Thank you very much, Natalia, for this presentation, for laying out for us the specific vulnerabilities and equity issue, highlighting the existing gaps in the response. The issues of fragmentation are also really well taken. The need to look at the missing middle, but also the opportunities to build back better, and how social protection systems need to be strengthened for an inclusive recovery. Point well taken on the need to join forces. So after these, I think, great framing presentations, we will move to the panel discussion part of this webinar. We will I invite the panelists to unmute their microphones when they are invited to speak. The panelists that will join us today for this part of the webinar are from Azerbaijan, Mr. Ozal Mohtabarli. He's the head of actuarial calculations, sector of analysis and strategic planning department from the Ministry of Labor and Social Protection and Population. For the Q&A part, Namig Shalbuzov will also join from the Ministry of Agriculture. He is Deputy Director of the Agrarian Research Center. From Kazakhstan, our panelist is Azel Shaymerdenova. She's Deputy Director of the Department of Social Assistance, Policy Development of the Ministry of Labor and Social Protection. In the question and answer parts, Ashkat Suleymanov will join. Ashkat is Executive Director of the Coalition for Green Economy. From Russia, we will have Olga Voron, Associate Professor from Higher School of Economics, and Elena Gorina, also Higher School of Economics. And from Serbia, Maria Babovic, Professor of Economic Sociology from the University of Belgrade, Serbia. From Romania and Albania, we will most certainly welcome the remarks from Alin Ignat, Secretary of State of the Ministry of Labor and Social Protection from Romania, and from Albania, Ms. Erviola Nelaj, Minister of Health and Social Welfare from Albania. We will start the discussion with a question. I would like to ask the panelists. Sorry, I don't know if you see my daughter. I'm sure. So the first question to the panelists that I would like to ask, if you could kindly describe the social protection measures that were taken in your country in response to COVID. You all have 3 minutes to respond. We can do this in no particular order, but just to start the discussion, I invite Ozal from Azerbaijan to start the discussion.
Thank you very much. Hello, everyone. Thanks for the webinar convened. It's a great webinar. Let me to introduce some measures taken in order to fight against the negative impacts of COVID-19 in Azerbaijan. As in other countries, we have seen it in our country also. Some administrative measures have been implemented and medical capacity increased in order to prevent impacts of COVID-19. We have constructed new modern hospital, and 10 modular type hospitals are ready for use. Special quarantine regime introduced in our country. Disinfection measures, mask wearing, social distancing instructions introduced. Besides that, we have a special agency in our country around such kind of application like Tabib. This mobile application has been launched, and it enables us to get electronic permissions, and besides that, to track geographical distribution of COVID-19 patients. It's very interesting. Activities related to combat COVID-19 and reduce its negative impacts have been launched with presidential decree dated back 19th of March. The decree was designed on 3 blocks: macroeconomic stability, economic block, and the employment and social welfare block. Action plan regarding the implementation of the decree expensed around 3.5 billion Azerbaijan manats. It's approximately more than 2 billion United States dollars. And envisaged support in the economic block of actions was directly to private sector, individual entrepreneurs, and soft financing issues, tax cuts, and other kind of projects implemented also. Let me to describe social part of the actions in just the most striking ones. The pandemic-related social support measures covered more than 48% of the population, and jobs and salaries of about 1.7 million wage workers in public and private sectors have been protected. As a ministry, we have monitored, we have implemented daily monitoring of the labor contracts, And the most striking fact is that the number of labor contracts has been increased, not decreased in our country. It's almost more than 100,000 labor contract increase in comparison with the beginning of the year. Besides that, the coverage of unemployment insurance payments expanded to additional 20,000 people. Sustainability of social security payments, pensions, stipends, and social benefits to 2 million citizens has been provided. Low-income families consisting of unemployed and informal workers who lost their jobs due to the special quarantine regime received one-time payments at the level of national subsistence minimum. It's more than 100 United States dollars. In Azerbaijan money, it's 190 manats. One-off monthly payment carried out for 2 months, and today also people in 16 districts of the country that declared to tighten its special quarantine regime received third time 190 manats. The involvement of 90,000 people in paid public works to increase employment opportunities and the establishment of at least 12,000 small farms within the self-employment program have been launched. Besides that, but not at least, during the special quarantine regime, the term for provision of targeted state social assistance program to low-income families has also been extended. In total, today we have 350,000 members of 83 families that are covered by the targeted state social assistance program. Besides such kind of activities, we also provided food assistance programs to more than 100,000 low-income families. Also, social services are provided to single people over the age of 65 and to people with special care needs in social service institutions. Thanks for your attention.
Thank you, Ozal. Thank you so much for these insights. Azel, would you like to go next?
Yes, of course. Thank you, Anna. My greetings for all participants of the webinar. During the state of emergency period, which lasted in Kazakhstan for approximately 2 months, unprecedented support measures were executed by the state. In particular, the Ministry of Labor and Social Protection of Population has conducted the following measures. I will be specific. First, a completely new payment of loss of income was introduced due to the state of emergency. This payment, equivalent to the minimum wage, it's around $105.4, was made from the state social insurance fund. The consideration of the application was carried out over a period of 3 days. This payment was intended for working citizens who have been forced to become unemployable. Applications for social security payments were made by 8 million citizens, but the payment was intended only for 4.6 million eligible citizens for a total amount of $799 million. Second, a food basket has been set to support citizens in particular need. The cost of the basket was set no lower than 2 minimal accounting index. More than 1 million citizens were provided with these baskets for 13.5 billion tenge, around $33.5 million. This category included children aged from 6 to 18 from among targeted social assistance recipients, children with disabilities, disabled people of all groups and ages, parents taking care of disabled children, and officially registered unemployed individuals. Third measure, 24 amenities in the operational mode were posted on the Citizens e-application service on the electronic government portal. Among other things, applications for targeted social assistance and for determining disability and degree of disability was accepted through the electronic government portal as well. Fourth measure, 108.9 thousand families, it's about 500,000 people, have been automatically reassigned for the second quarter of targeted social assistance. At the same time, the amount of the target social assistance payment was increased by 5%. The provision of a guaranteed social package for children aged from 1 to 6 been extended for the same time as a targeted social assistance term appointment. Fifth measure, about 18.3 thousand disabled people whose terms of re-examination came a month before the introduction of the emergency regime and during its validity were approximately extended for 3 months. Next one, temporary restrictions have been introduced in organizations providing special social services in order to prevent the spread of infections and exclude direct contact. For example, an express testing for coronavirus of all care recipients and employees of the organization has been conducted. In addition, until the end of the state of emergency, all employees are provided with accommodation at the facilities of this organization and additional payments similar to medical workers. The last one, measures are envisaged to ensure employment and creating new jobs as part of the implementation of the employment roadmap for 2020-2021. In 2020, there is an opportunity to involve 1.2 million people into employment. This includes 600,000 people under the state program UNBEC and 400,000 people under other state programs by local and central executive bodies. Within the frames of this program, an implementation of 6,107 projects was started, which created 130,600 places of work. Likewise, local executive bodies have submitted 6,509 projects, 2,400 of which are going to be enforced from the national budget funds. All measures that I listed above were carried out by the ministry during the emergency period to provide social support to those in need. Thank you so much for your attention.
Thank you so much, Azel. I think Olga will then follow with an overview of the federal response and Elena a regional response. And I would kindly ask you to stick to 1.5 minutes, 2 minutes each for this, so we don't go too much over time. Thank you.
Добрый день. Прежде всего, я хотела бы поблагодарить организаторов за приглашение выступить на сегодняшнем международном вебинаре. И вначале я хотела бы сказать, что такое общее вступление, что внезапная приостановка деловой активности и замедление экономики в связи с пандемией коронавируса потребовала разработки экстренных мер для поддержки занятости и доходов населения. И следует отметить, что в большинстве стран мира доминирует программа замещения утраченных доходов и поддержка потребительского спроса населения. Что касается России, то из-за всех многих путей компенсирования и поддержки она выбрала путь преимущественной поддержки семей с детьми, одной из наиболее уязвимых категорий населения страны. В целом, с начала пандемии российским правительством уже было принято 3 пакета мер в поддержку бизнеса и населения, половина из которых связана с программами краткосрочной поддержки доходов населения, включая в том числе и безработных. Среди них это кредитные каникулы, увеличение пособия по безработице до размера прожиточного минимума на краткосрочный период, освобождение от уплаты коммунальных платежей, и поскольку а также меры поддержки принимались как на федеральном, национальном, так и региональном уровнях. Принятые для борьбы с последствиями пандемии федеральные меры, о которых я немного расскажу, в поддержку семей с детьми классифицируются по 2 параметрам: по времени начала действия и по длительности действия. И мы выделяем 3 типа такой социальной помощи. Это новые меры социальной поддержки, имеющие кратковременные сроки действия и принятые специально для поддержки семей с детьми в кризисный период. Вторая группа мер – это постоянно действующие меры в социальной поддержке, влияние которых на уровень жизни семей с детьми усиливается в связи с изменением условий предоставления этих мер увеличивается сумма выплаты, изменяются сроки назначения и расширяется контингент получателей, и новые постоянные меры социальной поддержки, которые принимались в плановом порядке и были анонсированы в январе этого года, но начало пандемии коронавируса ускорило процесс их принятия. К новым, к первому типу мер социальной поддержки относятся единовременная выплата в размере 10 тысяч рублей на каждого ребенка в возрасте от 3 до 16 лет, и она выплачивается вне зависимости от доходов семьи. Размер этой выплаты достаточно высокий, он близок к прожиточному минимуму ребенка. И по оценкам правительства данное пособие получает почти 20 миллионов детей. Вторая мера краткосрочная – это ежемесячная выплата на ребенка до 3 лет в размере 5 тысяч рублей. Она выплачивается в течение 3 месяцев – апреля, мая и июня. И третья мера из этой категории – это ежемесячная выплата на ребенка до 18 лет в размере 3 тысяч рублей. Она выплачивается родителям, которые зарегистрированы в органах службы занятости как безработные и получают пособие по безработице. В целом, по нашим оценкам, данные пособия добавят в доходы граждан порядка 290 миллиардов рублей, и эти инвестиции составляют примерно 0,5% от денежных доходов населения в 2019 году. Это если коротко, потому что действительно можно долго рассказывать, тогда я хотела бы передать слово Елене.
Здравствуйте, уважаемые коллеги. Спасибо большое за приглашение. Я в дополнение к тому, что рассказала сейчас Ольга, хотела бы остановиться на мерах региональных, на тех мерах, которые были приняты в регионах Российской Федерации. Это важно, потому что в России значительную роль в обеспечении социальной защиты играет именно региональный уровень. Регионы вводят свои меры поддержки, могут вводить их за счет своих средств. И так и случилось в условиях пандемии. Многие регионы приняли различные дополнительные меры к федеральным, меры поддержки доходов и потребления населения. И кто же был основными адресатами этих мер поддержки? Ну, прежде всего, это, опять же, семьи с детьми, как и на федеральном уровне. В основном из традиционно уязвимых категорий. Это многодетные семьи, это малоимущие семьи, а также дети, которые перешли на дистанционный формат обучения. И это важно, я скажу об этом чуть позже. Также это вторая категория, это те, кто утратил трудовой доход в результате увольнения или простоя. Это не только безработные, это могли быть и те люди, которые вынужденно не работали, но безработными не стали, то есть не зарегистрированы как безработные. И важная категория – это лица, находящиеся на самоизоляции, то есть те категории граждан, которые маломобильны, то есть прежде всего пожилые, инвалиды, которые вынуждены были находиться на самоизоляции, поскольку риск заражения для них очень высок. Значит, что предпринимали регионы в качестве дополнения к федеральным мерам поддержки? Первое, многие регионы увеличивали размер выплат, введенных федеральным центром, то есть в дополнение тем же самым категориям дополнения просто добавляли некоторые суммы денег, опять же, единовременно или ежемесячно на короткий срок. Кроме того, регионы расширяли категории получателей. Например, на федеральном уровне была принята единовременная выплата на детей с 3 до 16 лет, но общественное мнение очень активно критиковало эту меру, поскольку дети с 16 до 18 лет, то есть дети до совершеннолетия, они также не работают, многие учатся, то есть им тоже необходимы средства к существованию. И поэтому некоторые регионы расширили категорию получателей и стали выплачивать эту выплату детям с 16 до 18 лет. Кроме того, были введены в отдельных регионах выплаты для пожилых, которые соблюдают режим самоизоляции, чтобы таким образом стимулировать их соблюдать этот режим еще больше, чтобы они...
Elena, sorry, can I ask you to just wrap up a little bit? Sorry, we're just running a little bit out of time. Thank you.
Я закончу очень быстро. Я просто хотела сказать, что очень важное и распространенное направление – это натуральная помощь, которую вводили многие регионы. Это продуктовые наборы, которые по возможности составлялись из товаров местных производителей, и они предоставлялись как для различных уязвимых групп населения, пожилых, многодетных семей, так и для школьников, которые в свое время получали бесплатное питание в школах, но после перехода на дистанционное обучение перестали его получать. Это дети-инвалиды прежде всего и дети из малоимущих семей. Пожалуй, тогда на этом все. Спасибо.
Great, thank you very much. I would like to give the floor to Maria Babovic.
Thank you very much, and good morning to everybody. I'm very happy to participate in this webinar. Serbia was faced with very restrictive regime during the spring part of the pandemics. Then it had sudden release of all measures, and due to the fact that we had government wanted to proceed with the elections at the end of June, now we are facing even higher peak, and the situation is really critical. Right now, I don't know, maybe some of you even heard that last night we had huge citizens rallies with a lot of conflicts with police. Numbers are much higher than it's officially reported, and we are struggling quite heavily with pandemics. We conducted a survey already during first peak of pandemics. Measures were very restrictive, so there were curfews, sometimes lasting for 4 to 5 days. Everything was closed, public transport was cancelled, schools, kindergartens, everything. And we did survey on the representative population of persons who were employed during February, so before the pandemics, to measure the impact of government measures and the pandemics. It was April and then in May. And then based on that data, it appeared that rural population was impacted more than urban population in all of these measures. And the category actually that faced the strongest impact, negative impact, with the major loss of jobs were rural women. So for example, just to illustrate, while general rate for loss of jobs was 8%, for rural women was 11%, compared to urban women where 7% of women lost their jobs. So impact was huge, and if we check the reasons why rural women lost their jobs, mainly the reason was that those were women employed outside of agriculture, outside of farms, their family farms. So they got fired because their company stopped to work. The next category is those who were occasionally with short-term contract employed, and they lost jobs because contracts were not prolonged. And then third category, it's very gender specific. So women had to give up of the job because they couldn't organize care for children. Children stayed at home, and they couldn't come to work without public transport. This is something that is famous. Rural women in Serbia, much more than men, rely on public transport. They do not drive their cars. And this impact was not supported with appropriate measures. We have certain spectrum of measures for social protection in rural areas. I will not speak about them. Those regular measures are same for general population and rural population. Just there are certain restrictions for rural population to access those measures, especially financial assistance, for example, because if they own certain portion of land, then they have to give up of that land in order to be entitled to those measures. But what was a specific measure during COVID crisis? It was the completely universal one-off financial assistance of 100 euros. It went to all families, to all individuals actually, So women, men, rural, urban, and it was not tailored specifically according to needs of urban population and especially rural population and especially rural women. So also what our survey showed, we did one survey similar in 2008 where we explored in details what is the access to social rights of rural population and especially rural women. And we found no change in over 10 years. Actually, we found that 2/3 of women working exclusively on family farms in agriculture, they're not covered with retirement insurance, with disability insurance. So this really reveals a very serious picture on lack of protection of some basic social rights of population and especially women that is engaged in agriculture. So this is a snapshot of the situation right now in Serbia. One of the major problem for rural women active in agriculture was the interruption of supply chains. That was at the same time, it was challenging, but also opportunity to innovate. So they found some new channels to sell their products. They started to use more digital channels, though this is again that digital gap prevents them to use more that kind of technology to address the challenge of interruption of supply chains. And the government.
Maria, I'm so sorry. Could I kindly ask you to wrap up?
Yes,
Great,
finishing last measures. Last measures come from Ministry of Agriculture is financial assistance to agricultural producers and better access to credits. And women engaged in agriculture, they assessed first measure as relatively favorable, but access to credits not so much because they're really, those are usually small farms. They're not, they're reluctant to take credits. So voila, thank you for your attention.
Thank you so much, and sorry, I have the task to keep the time. I know that Ms. Erviola Nelaj will also wanted to say a few words. Erviola?
Yes. Hello everyone. Thank you for the invitation. I really appreciate it. I will go not very in details. I will be very short to see the measure what Albania, the government of Albania, especially Ministry of Health and Social Protection, has taken, and let's say that these measures are in a short-term period. Shortly, I will describe the first measure were made for the people or for individuals and families, poor families that are beneficiary of economic assistance. They were given the double amount of the economic benefit for 3 months. Also for the individuals who benefit from unemployment payment, also for them was given the double amount for 3 months. For the workers in affected entities, in the small entities, were given a monthly wage in the level of minimum wage, and this was given for 3 months. Also for the workers that work in medium and big business and those especially in the tourist field were given a lump sum amount, once a lump sum amount. Also were given food packages for people in need, for vulnerable groups, especially for elderly in needs, for people with disability, and also for those households, those families that were affected because Albania is in the recovery stage of the earthquake that we had last November. This package was food and non-food packages also. Also, we have to think about for those who works in, because the coverage for those who work in informal sector and for those that are seasonal workers. This was the coverage that we cannot reach, but we have a lump sum. We think about to have a lump sum for those individuals or households that has applied to benefit from the economic assistance, but have not been selected or have not been eligibility. For those, we have given a lump sum amount only once. So this was the short-term and measures, but we think that the challenges is we have to develop measures that be medium term to see all the social protection scheme in order to respond better to the impact, because as we see, the impact of COVID will take a sustainable amount of time. Thank you.
Thank you so much, Erviola. I don't know if Aline would like to respond to this one, or yeah, okay. If you can stick to 3 minutes, we will try to catch up time in the Q&A and the second question. Thank you.
Sure, thank you. Greetings to all participants, and thank you for inviting Romania to this webinar. I would like to talk a little bit about the measures that we have taken at the Ministry of Labour and Social Protection in Romania. Of course, there have been a lot of measures taken by the government, by the Finance Ministry for the companies, but I would like to talk a little bit about the measures taken concerning the labor market. This period started with the decree of the state of emergency imposed by the spread of the coronavirus, was and still is a difficult period for all Romanian citizens. And I'm going to describe part of the measures that we have implemented in this period, and part of them are still going on and will go on mostly until the end of the year. So the first measure is the payment of the technical unemployment for the employees of economic operators whose individual employment contract was temporarily suspended at the initiative of the employer during the state of emergency and as a result of the effects of the COVID-19 pandemic. So for the period of temporary suspension of the individual employment contract, the technical unemployment benefits amount to 75% of the basic wage, but not more than 75% of the average gross wage at economy level. This allowance was subject to taxation and payment of social and health insurance contributions without owing an insurance contributions for work. The benefits are paid by the National Agency of Employment from the unemployment budget throughout the state of emergency and the state of alert periods. Also, we have established an indemnity for other professional categories who have interrupted totally or partially their activity, including athletes, lawyers, people working exclusively on copyright and related rights affected by the decisions of public authorities to reduce the spread of the coronavirus pandemic. For these categories, the support is provided from the state budget and paid through the country agencies for payments and social inspection. And this indemnity represents 75% of the average gross wage at economy level provided by law in Romania. These measures that I'm talking about will apply also after the 1st of June 2020 for the activities where restrictions are maintained. New application forms have been developed and have already been included in the electronic platform and accessed by beneficiaries. So far, about 1.3 million employees and professionals have received these benefits in Romania, for which the state has paid allowances over 4.3 billion lei. So that's around 930 million euro. Also, we have provided active support measures for employees and employers in order to support the resumption of economic activity. So employers whose employees have had their employment contract suspended for a period of at least 15 days during the state of emergency or alert periods, who maintain employment contracts with their employees, receive monthly for a period of 3 months from the date of ceasing the suspension of employment contracts, but no earlier than the 1st of June 2020, an amount representing 41.5% of the gross basic wage corresponding to the job, limited at 41.5% of the average gross wage at economy level. Also concerning families with children, the allowance for free paid days granted for parents who are caring for their children during the temporary closure of educational units. So here we have established an indemnity of 75% of the wage corresponding to a working day for the parents who stay home with their children, but no more than the daily correspondent of 75% of the average gross wage at economy level. Also, we have ensured for a period of 90 days the payment of the monthly insertion incentive and the support allowance for raising children with disabilities. Another measure is automatic extension of the rights of child raising indemnity, parental leave, in case of the beneficiaries who are receiving the child raising indemnity on the date of establishment of the state of emergency. This will continue. This measure will continue during the entire period of the state of alert and also for 30 days after this period. In the domains where we still have restrictions, this measure will continue so far as 31st of December 2020. So all in all, these would be some of the measures that Romania has taken in this period. And we also have measures that will soon be taken by the government for all the categories affected by the pandemic. And we hope to learn many things today from the experience of other countries in order to take measures accordingly with these experience that the participants share today. So we welcome this meeting, and thank you again for inviting us. We're very attentive to everything that happens, and we'll share our experience today with all of you. Thank you.
Thank you very much, Alin. I would now like to give the floor to Dono Abdurazakova. She is Senior Advisor for Gender and Social Protection in the Regional Office for Europe and Central Asia, Eastern Europe and Central Asia. Dono will facilitate the question and answer part of this webinar.
Hello. It's a great pleasure to be part of this webinar, and thank you very much for very interesting insights from the countries. We received quite a few questions from the attendees, and some are very important and comprehensive, and many are directly linked to the topics of this webinar. If I summarize these questions, they are mostly about specific actions that governments of Central Asia and Caucasus are undertaking as a response to negative impacts of COVID, and particularly targeted towards informally employed or returned labor migrants. In fact, several questions are particularly strengthening labor migrants, and mention about camps that have been formed over this period in the borders, particularly between Kazakhstan, Uzbekistan, Russia. And if labor migrants receiving any form of social protection support, be access to healthcare services or others. Question also asked about youth employment, how pandemic impacted rural areas, and what opportunities governments are offering them to support them in these times. There was question about food vouchers, but I think that in presentations, this has been already partially answered. We've heard that in Russian Federation, in Kazakhstan, people are offered food baskets, but it would be interesting to hear more elaboration on that. But two questions I marked as particularly interesting and important to help us to come up with the conclusions of this webinar. One is what recommendations can be given to the government of the countries who have no material or I understand financial also resources in order to meet the challenge of COVID. And other question is, what do we need to change at system level, thinking forward in order to mitigate the COVID impact to many other challenges to come in future? Can we provide a few potential and long-term solutions? And there were some questions that I already directed to the panelists, to Ben and to Natalia. I suppose in their response they would be able to read them, but before we move to question and answers, we received a request from Mr. Asghar Suleimanov from Coalition for Green Economy Global G in Kazakhstan, one of the biggest and very active NGOs in environmental protection. So I would be pleased to give a floor for a minute to Mr. Suleimanov first, before we move to question and answers. Thank you. Over.
Спасибо, Дона. Добрый день, коллеги. Я буквально вкратце расскажу о нашей работе. Ну вот коллега с Министерства труда рассказала, какие меры социальной поддержки оказываются государством. Мы, как неправительственная организация, еще до пандемии начали работать с сельским населением, а именно вот у нас вот остро ощущаются вопросы по женщинам именно. В Казахстане проживает порядка 19 миллионов человек, и из них 46% проживают на селе. И мы с 2013 года реализуем проект по поддержке сельских женщин путем их обучения зеленым технологиям, создания зеленого бизнеса, скажем так, на селе. И каждый год разыгрываем гранты в размере $4000 США. Значит, 10 победительниц каждый год у нас определяются, и уже на сегодняшний день у нас 61 победительница, которые открыли на селе более, значит, 150 новых рабочих мест. Тренингов прошло уже порядка 15400 человек прошли тренинги. Помимо этого, которые вот получили грант, еще есть не получившие грант. Для них мы, значит, сопровождаем их по разным государственным программам. Они могут профинансироваться, получить гранты по линии государственной программы ЕНБЕК, либо же получить дешевые, значит, кредиты и открыть свое дело на селе. Следующий, значит, проект, который мы реализовываем также, это областные форумы с прошлого года. 14 областных форумов мы в 14 регионах провели. В этом году, понятно, в связи с пандемией мы эти форумы проводим в онлайн-региме. Также здесь мы охватываем разные вопросы, показываем другим женщинам, значит, успешных женщин их регионов, рассматриваем вопросы поддержки в части государственных механизмов. Здесь же рассказываем о вообще целях устойчивого развития. Мы, кстати, к слову сказать, что с прошлого года организовали конкурс среди сельских женщин отдельно, значит, по всем 17 целям лидерам ЦУР. Женщины определяются, значит, по каждой цели лидер, значит. Аналогичный конкурс мы объявили среди средств массовой информации и продолжаем эту работу. Значит, один из наиболее значимых проектов, также можно сказать, проект по, скажем так, одно село, один продукт, по принципу одно село, один продукт, поддержан офисом ФАО в Казахстане. И мы выбрали 3 пилотных территории, где работаем также с социально уязвимыми слоями населения. Если, допустим, смотреть, это Западная Казахстанская область, там мы людей приучиваем к птицеводству. Значит, товарное птицеводство. В Алматинской области это овощеводство, и в Караганинской области это молочное скотоводство, животноводство. И тем самым мы население, значит, к сельским жителям подтягиваем различных опытных тренеров, показываем, как можно получить хороший привес или удой, допустим, и тем самым создать свое собственное дело на селе. Вот такие, как бы, ну, наиболее значимые проекты. Я коротко рассказал о нашей работе в период пандемии. Спасибо.
Thank you very much. Thank you very much for interesting input. It shows how the work of the government is being complemented by the efforts of civil society organization. But Anna, if I may hand over to you to manage questions from your side, the questions that I mentioned earlier. If we could give a floor first to Natalia, would you like to be the first to answer the questions?
Sure, thank you, Donald. I'll try. There were many, very interesting, and some of them we're still, I think, trying to understand what are the best course of action. But to me specifically, there were two questions. One was around how to make the recovery process, the stimulus packages a bit more inclusive, and also questions around the system level and how we make some changes so we don't just stop at the temporary measures, but really take advantage of system work. And then a specific question of UNICEF's work around communication and misinformation. So let me maybe start with tackling the complicated one, which is around the inclusive process and how do we continue working with governments to make sure that as we face a recession, and we know that many governments will need to make difficult cuts and difficult decisions, that they have also the appropriate information, analysis, data, and support from the UN group, for instance, to be able to make choices that minimize impacts on the most vulnerable, including children and rural populations in this case. I think there are two parallel processes, right, or strategies. One at global level and really being vocal in the high level discussions, such as the financing for development structures, for instance, that 2 weeks ago was, there was a very interesting discussion with many government leaders really pushing for a much more stronger and inclusive perspective to recovery. But I think maybe more critical at country level, no? Enhancing our strategy and our partnership with the IFIs that are right now identifying and defining such packages. For example, given the example of the IMF, they do have a social spending strategy, and I think it's an effort and a work for us as UN and governments to make sure that the emergency responses that they're doing in the context of impact of the context of COVID are very much responding to what they've claimed they wanted to do in terms of protecting social spending. I think we do have a work to do in also putting very clearly the lessons for previous recessions and fiscal contraction processes, where definitely a lot of the cuts that were made actually contributed to reversing process around poverty reduction and food security. And we don't want to repeat those same mistakes as we go forward. No? So I think it's a question of making visible what those cuts will result, to have a very strong strategic partnership with IFIs to be able to influence some of those processes and work very alongside with governments to make sure that they, as they're making the hard choices, did have minimal impacts to the most vulnerable. In terms of the system level and how do we want to change a little bit of that perspective, I think that's one of the core messages that I hope I was able to discuss during the presentation. I think it's definitely important that the governments have been committed to using social protection systems and to defining some immediate responses in terms of short-term cash transfers or compensation measures. But it's important to know that it will not be enough, that this is the moment to also use some of these emergency funds and social spending funds to be able to invest in making the systems much more stronger, as a preventive, if you want, strategy, as this is a long-term process that will continue to have impacts across different sectors. I do think that particularly for the ECA region is the opportunity to make the systems more inclusive and looking at the parts of the system that are right now, I think, lacking, and looking at the informal sector, at the care economy, at women's programs, of course, child benefits, to make sure that we are not just having a blanket response, but we're actually going further and taking this opportunity to address some of the key coverage and adequacy gaps. In terms of information and what UNICEF is doing in that regard, there's two parallel approaches as well. One is a very big campaign launched by the executive director across social media and other channels to really make sure that adolescents or children are empowered in terms of information and misinformation. What are the best sources of information? How do they have a critical mind also to understanding what are the things that they should filter, particularly now that they have much more contact to internet and other types of digital sources. But maybe equally most important, the work that the C4D, the Communication for Development Group, is doing at community level, trying to focus on messages around transmission prevention in terms of hygiene and social distances, how to use health services, what are the right access or the points of access of information at community level, combating some of the myths and stigma around the pandemic. And I think there's a lot of work in trying to empower community members, particularly adolescents and children, to be also the voice, if you want, of information, and working with their peers in able to share those views, as well as equally working with government to make sure that the information that are provided in terms of the response are socially and culturally appropriate, to be able to really reach the most vulnerable, those that are in remote areas, those that maybe do not speak the main language of the country, and trying to make sure that information reaches the community effectively. I'll stop here. Thanks, Donna.
Thank you very much. I would like to approach members of the panel if they would like to address the questions raised with regard to specific measures that are related to rural youth and labor migrants. Can I ask participants from Azerbaijan or from Kazakhstan bring concrete examples of such measures?
Hello.
Ms. Asejna Mirdenova
Yes.
and Mr. Ozal Mokhtabari, thank you. Yes, please go ahead.
Actually, in Azerbaijan, we didn't get through such kind of problem, because workers from Azerbaijan mostly are immigrants in Russia and Turkey. And as we know, they didn't have any kind of specific problems regarding their working places, and they could get some payments from the government of Turkey and Russia. Besides that, the problem arises in Azerbaijan is that from the economic perspective, the remittances that they sent to our country from the abroad, the countries they worked, the remittances really just deteriorated, or they just stopped to send remittances to our country, and this had some problems regarding the balance of payments and other kind of economic consequences. That's all. But from the employment perspective, we didn't have any kind of great problem regarding the foreign workers or labor migrants in our country. Thanks for the question.
Thank you. Asej? Asej, could you unmute your mic, please?
I'm sorry. When we address our state support for the people, we usually address it only for vulnerable people and who is extremely in need. So labor migrants, they are not in our database. So we don't provide any social support for them. Thank you.
Okay, this is very interesting and useful to know. Is there any information that we have by now of what measures are considered to be most effective, what works and what is not working? Any insights from the regions that we can hear from the participants, from the panelists?
Can I add some words?
Yes, please.
Спасибо, я по-русски быстро скажу. Да, я хотела бы очень коротко сказать о тех специальных мерах социальной защиты, которые были в России специфично для сельских жителей. более специфично для сельских жителей. И здесь, мне кажется, очень важно выделить две проблемы, с которыми эти меры работали. Это мера по обеспечению дистанционного обучения, потому что когда школьники ушли на дистанционное обучение, очень многие из них в сельской местности, в удаленных поселках не имели, ушли на дистанционное обучение, не имея нормального доступа в интернет, не имея даже компьютерной техники достаточного качества и количества, да, может быть, один телефон на всех. И ответом на этот вызов, на вот это вынужденное такое обучение было обеспечение школьников, прежде всего, вот этих отдаленных поселков, сельской местности, компьютерами, планшетами для дистанционного обучения, а также модемами с безлимитным доступом в интернет. И надо сказать, что это были инициативы местного характера. То есть особенно большую роль играла в этом общественная и частная инициатива, то есть благотворительные средства. Это сотовые операторы, которые бесплатный интернет для школьников обеспечивали, да, бесплатными модемами их обеспечивали. Но и такой путь был, как по обеспечению этих школьников, как из образовательных организаций было разрешено передавать технику в семьи, да, для того, чтобы ученики могли продолжать свое обучение. То есть вот мне кажется, что эти инициативы, они могут быть в качестве лучших практик использованы. И вторая проблема, более специфичная для сельских жителей именно, это то, что ограничения в экономике, да, режим самоизоляции, ограничительные экономические меры, они совпали по времени с началом полевых работ. То есть весной, когда по известной пословице «день год кормит», да, многие люди были отрезаны от возможности свое личное подсобное хозяйство расширить или дополнить. И в некоторых регионах были такие практики, как обеспечение населения семенным картофелем, да, посевным материалом, даже домашним скотом, с запасом кормов, для того, чтобы люди могли расширить свое личное подсобное хозяйство. И, например, выплаты на то, чтобы люди могли приобрести этот семенной материал, чтобы садоводство или огород свой, да, выращивать. То есть это, конечно, не доступ к оплачиваемой занятости, но это способ обеспечить свою семью в условиях снижения трудового дохода, обеспечить свою семью хотя бы натуральными продуктами. И также такая практика, мне кажется, тоже интересно ее упомянуть, как централизованный найм на сезонные работы в сельском хозяйстве для тех людей, которые потеряли занятость или трудовой доход, на такую временную, да, работу, например, на посевную или для сбора ягод, да, то есть там, где не нужны специальные квалификации, людей просто централизованно через Министерство сельского хозяйства, продовольствия набирали на то, чтобы они могли эти работы обеспечить и в то же время получить с этого какой-то доход.
Yes.
Спасибо.
I'm very sorry, Elena. Thank you so much. It's very valuable and very interesting information. But we have so many questions. I think we should try to respond them. If not now, at this session, at this webinar, we will try to respond in writing and be in contact with the attendees who pose these questions. I would like to give a floor for last comment to Ms. Erviola Nelac from Albania before handing over back to Anna. Thank you.
Yes, no, what I was intending to tell, because as we heard from all the other countries, the measures were taken were at the short term. And as we think that the impact will continue, we need to think the challenge is how to better to strengthen the social protection in our countries, given the limited financial resources that we have, because everyone wants to increase the amount of benefits of every cash assistance programs, but this is not given into the limited financial resources that we have. So one of my suggestions, and our government what is doing, just to seeing the existing cash assistance programs, seeing the eligibility criteria, and seeing the adequacy of the benefit amount, and how to better targeting the people, the poor people and people in need, in order to coverage those who are really poor people and in need. So, for example, we have the economic assistance scheme, and we are using proxy means test for this eligibility. And we are thinking to extend this economic aid scheme by increasing maybe the score threshold, or we are thinking about to create the 2-score bandwidth. So we have different benefit levels for benefit different categories. This is what we're thinking. So what I'm suggesting is that everyone should give into the limited financial resources that we have to see how to see the eligibility criteria and to better targeting the people in need. Thank you.
Thank you so much. Cash Plus pilots have been implemented in Armenia and Kyrgyzstan over recent years as a pilot, and they received very good results. And in fact, we are getting feedback from the region, from Armenia, from Mr. Zaruhi Bilgaryan, that they had rapid assessment of COVID-19 impact on rural, socially vulnerable population involved in Cash Pilot that was implemented under the FAO project. And the results of the assessment showed that project beneficiaries better coped with the situation with more balanced nutrition. So it's still wealth of information that we need to collect in this region in terms of the impact and the social protection measures and responses and their impact. But we have limited time. I am handing over back to Anna with thanks to everyone for their inputs. Anna, over.
Thank you so much, Dono, and thanks to everyone, the panelists and the attendees who asked such relevant questions. I will now give the floor to Benjamin Davis, who will give the concluding remarks for this webinar.
Great, thank you very much, Anna, and thanks everyone. Really, it was quite a fascinating discussion, listening to the broad diversity of experiences, of initiatives, how the different countries are facing this really unprecedented shock. It's been interesting to hear, again, the different experiences, the countries which are still facing big challenges in terms of and hard decisions that they need to make. The one that was brought up in the chat, for example, by our colleague from Albania, the challenge in Serbia, some of the interesting initiatives that have been taken in different countries around labor contracts. It's very interesting. I'd like to learn more about that. I think the big challenge that we face, I mean, there's a lot of faces about the financial constraints and where do we move into the future. And there was a number of questions and comments that we didn't really get to about, okay, short term, how do we begin to think about the long term, and where is this going to take us in terms of the recovery? No? And it's never too soon to start thinking about the recovery, because I think decisions are already being made and plans are being made. And so how do we move from this? So policymakers have suddenly seen, okay, so why social protection is so important across the globe, you know? And so how do we take advantage of this momentum to continue to cover the gaps that have been identified, to extend coverage, but really kind of strengthen this commitment to the role that social protection plays beyond just responding to this immediate needs, but rather to really foster a more sustainable, inclusive process of economic recovery and beyond. And I think it's important, and this is linked to the questions that some people had about, okay, what kind of social protection for the long term in lower and middle income countries, is thinking about systems, et cetera. And I think some of the keys are, it's important to I mean, we have a diversity of solutions because there's diversity of context. There's no one program or set of programs that should be in every country, but rather need to respond to the context of every country. I think looking into the future, I think the important is to link social protection beyond just to an emergency response, but rather link it to a strategy for development and a strategy for economic recovery, and the importance of linking it to livelihoods, right? And these are livelihoods both in terms of wage, informal wage, many of the migrants that we've heard about, as well as, you know, literally the hundreds of or the millions of mostly informal participants along the food system, particularly in rural areas. But linking this to a process of economic recovery where households don't have tools with which to manage risks, right? And this is kind of the key element which allows them to participate in this process of economic recovery. It's also very important, again, to have the systems approach that Natalia was talking about. Very important to link it to health insurance, to quality health services, to think about the life cycle, to think about the different kinds of measures that depend on one's, you know, labor status and the way one relates to the economy, and particularly takes into account the very specific vulnerabilities of rural areas. And again, in social protection is key. Again, we're here in the middle of the COVID crisis, but it's really fundamental to all these big issues that we've been talking about before COVID, which were around climate change, around healthy diets, around food systems transformation, which is kind of, you know, becoming the dominant development narrative, and which frankly is still kind of the fundamental approach that we as an organization and that really many countries are taking in terms of looking towards a process of more sustainable economic development. And I think the key is to show how social protection really plays a fundamental role, right? We can't just focus on the economic aspects, but as we've seen, houses are made vulnerable through a whole series of dimensions on the social side that we need to link with the social protection, as well the role that it plays just in helping households manage risk. And so I think that's the big challenge, and I think we need to face these immediate questions, but also look to the future and position ourselves as to how we can make these links in these big discussions that would be going on in every country. Thanks, Anna.
Thank you so much, Ben.
Dear Anna, I'm so sorry. May I add just a few notes to Benjamin? Thank you, Benjamin, for the clarification. But I think policymakers should know the character of their nation. I think there is not any kind of strategies that best practice or one fits for all such kind of strategies. I think policymakers should do lots of things on this issue. But in our country, actually, our conversation was about the rural population, but we have not such kind of great problem regarding them. But due to the COVID-19, the most damaged part of the population, I think, is young population, young generation. Today we can call them like lost generation. They mostly damaged because of they can't afford or find jobs. This situation, and mentally they are devastated. I think we have to find solution and deploy programs on this issue. Thank you very much.
I couldn't agree with you more. Absolutely.
Yes, thank you so much, Ozal, for this last few words, and thank you, Ben, for the concluding remarks. I also want to thank really all participants, all the panelists, as well as the organizers and the technical and communication team working behind the scenes. This has been really a great webinar. I have learned really a lot. It's impressive, all the initiatives going on in the region. We will share with you the presentation that we have from Natalia and also a link to the recording of the webinar. And as well as, I think Dono promised some written responses to the questions that were raised in the chat box as well as in the Q&A box. Thank you so much. Please tune in for the 5th webinar in the REO series, which should be on the 22nd of July on the topic of the role of agricultural research institutions and academia in the post-COVID-19 era in the region. Well, thank you so much, and see you all soon.